Hello, everybody. Welcome to this webinar, Active Travel, the Magic Pill, which is the first in a series of webinars we shall be seeking to run approximately monthly under the heading Healthy Aging, Healthy Planet. My name is Rod Crichton, and I'm a member of Bold Climate Action. I'll be joined by my colleague, Christine McGee, later in the webinar. A brief word on us here at Bold. We're a group of older people who are motivated to act with urgency to address the climate crisis in a just and fair way. We're concerned about the impacts of the climate crisis on those who are disadvantaged by poverty or exclusion, especially those impacts particularly affecting our age group. We want to support older people in their understanding of the climate crisis and to encourage them to take action on this. We want our voices to be heard. We also want to look out for young people, our grandchildren, and future generations. So why are we having webinars on the subject of healthy aging, healthy planet? Well, I think we probably can all agree there comes a point in everyone's life where we have to acknowledge that we're aging. Changes start to occur. When we were younger, we maybe took a more devil-may-care approach and picked up the pieces afterwards, presuming that we'd readily bounce back from excesses of certain behaviours or the lack of certain other behaviours. But it becomes apparent with the passage of time that we need to take more care of ourselves and invest in our health in order to extend not just the length of our lives, but maintain the quality of our lives. The same is also true of the planet we live on. In the past, humanity has largely taken the environment of the earth and its resources for granted. Just as we understand that we ourselves have limits, we learn so does the planet. Just as we look after our own health, so should our actions do right by the planet for everyone's sake, for us and for future generations. And I hope we'll be able to show in this series of webinars that there's a sweet spot when we adopt certain health changes for the good of our own lives, even sometimes modest changes, that we'll also be helping the health of this planet that we share. We're very fortunate to be running this webinar and future events on health in partnership with Irish Doctors for the Environment. Our speaker today is Dr. Clarke, consultant psychiatrist in Psychiatry of Old Age at St Vincents University Hospital in Dublin. As well as being the lead on active transport for Irish Doctors for the Environment, Caoimhe is also a member of the Climate and Health Alliance Active Travel Working Group, and one of the authors of their paper, which by a strange quirk of fate shares the same title as this webinar, Active Travel, the Magic Pill. She describes herself as an enthusiastic urban dweller, micro-gardener and city cyclist who cycles to all her domiciliary visits. Passionate about clean, green city spaces and making easy, safe, active travel accessible to all ages. She doesn't say she also does a mean presentation and webinar. Caoimhe will be joined today by Orlagh Gaynor. Orlagh is a physiotherapist and chair of Irish Doctors for the Environment. She's currently undertaking a postgrad study of planetary health, which is a link between the environment and health. I know you will find Caoimhe's presentation stimulating, very informative, and also entertaining. But first, a few words from Orlagh. Thank you.
Hello, everybody. Thank you so much, Rod, for that lovely introduction. And you're all very welcome here today to this webinar on active travel, the magic pill. My name is Orlagh. I'm as Rod said, I'm the chair of Irish Doctors for the Environment. And so Irish Doctors for the Environment are a voluntary NGO of healthcare workers. And we are a registered charity consisting of healthcare professionals and students in Ireland. We aim to create awareness, interest, and implement action around environment, health, and the impact it has on our patients. We work alongside various NGOs, environmentalists, scientists, and other organisations to educate and promote healthcare as a key issue in climate change. So we are not only doctors. It's a slight misnomer as our organisation has grown, which is a very, very good thing. I myself am a physiotherapist by background, and I am studying postgrad in environment and health. So I do love personally to just informing patients of the health benefits to people and to planet of of keeping moving and promoting physical activity. So Eva has a wonderful presentation lined up for you, and I hope you enjoy. Thank you so much.
Super. Thanks so much, Orlagh, and for Emma, Jane and Rod for the lovely introductions. I'm going to just do the techie bit here and share my presentation. So I'm all eyes on Emma to make sure I do this right. But this should work. And apologies now for the bit of delay here, Emma, because I'm going to share this. Can everyone see that okay?
Yes, we can.
You can. Do you know what I want to do? I just want to make it bigger.
Yeah.
Oh yeah. Is that okay for everyone?
Perfect.
Silent thumbs up. Great. Okay. That's the first hurdle over for me anyway. Okay. So as I'm going to just move these, I can see everyone's faces on my own. I'm just going to move them out of the screen so I'm not distracting myself. So yeah, as you all know, my name is Caoimhe. I am a consultant psychiatrist in old age psychiatry. I'm based over in St. Vincents in the south of Dublin. I live in the north side, so I travel across the Liffey, across city, and this is me on my wheels. This is my general mode of transport to get around. To, as Rod said, I do all my home visits. So our team is made up of a group of different healthcare workers, and actually a good few of us cycle to see all our patients in their homes, and that's just generally how I get around. So today I'm going to talk about active travel, public transport, and why we believe this is a magic pill. I've got a couple of disclosures. As a doctor, you're supposed to put this slide up where you've, conflict of interest and disclosures, but these are my disclosures today. I've been referred to as a cycling psychiatrist. I've been referred to as a pedal pusher. Now, I think the latter possibly wasn't a term of endearment, but I'm going to take it as that, and I now wear it as a badge of honor. On the top corner of your screen, hopefully you can see that, that's me on my way into work along the Royal Canal in Dublin, which has a lovely new segregated cycle path and pedestrian pathway, so I can get in and out to work usually on time and safely. And some of my affiliations are on this slide. So that picture at the top with the cross and the heart, that's the Irish Doctors for the Environment logo. I'm also a member of the Irish Cycling Campaign, and as Rod explained earlier, I'm on the working group for the active travel group on the Climate and Health Alliance. So I suppose I wanted to flag about the magic pill in particular because we published a report October of last year in the Lord Mayor's Mansion House in Dublin, and that's how I kind of got to know some of the great work that Bold have been doing. And this report is basically an evidence-based report created by a group of healthcare professionals, and we looked at how active travel and public transport is really, really good for our health and why we think it is the magic pill. So I'll reference that throughout the presentation, and there's a link at the end that we can share for anyone who'd like to read that report at their leisure. I'm going to make another kind of few disclosures as well. I do drive a car, surprise, and I don't regularly exercise, and I can explain, I have reasons for that. And as a community psychiatrist, as I've already said, I work with people over the age of 65, specifically with new mental health illnesses, previous mental health illnesses, and also dementia. And we work specifically in the community, so we see people in their homes. So you might see me cycling around if you're living around Greater South Dublin area. I'd like to start with just asking people to have a think about their own active travel history from when you were growing up and to where you are now, and to give a brief background about my history. So I grew up in County Louth originally, and I grew up about 2 kilometres outside of the town. So in order for myself and my sisters to get into the local shop, it was walking or cycling. That was normal for us. That was the options. That's what we used. Then I moved to Dublin to study medicine, and then I quickly realised the fastest way to get around was walking using the bus or cycling. I was a poor student, I couldn't afford a car. And then when you study medicine, you get sent around different sites and hospitals. So the bike came up from Louth, back up to Dublin so I could use it to get around. And then fast forward a few years later, after I did my training in psychiatry, I got my first consultant job in July 2020. And it was the first time I was solely based in the community. And I thought, oh gosh, I'm actually going to need a car. I didn't own a car at the time, where I lived. I didn't really need one, so it was fine. But I was also a bit too cheap to want to make a big purchase of a car. So I got a 20-year-old Volkswagen Polo. It was a silver little car that was an absolute banger. And it lasted 6 months, and then it promptly gave up life on the road. And then I realized, well, I had no other option. I went back to the bike again. But actually what I found is that I was working in North Greater Dublin, that side of the city. Most of my home visits were 15, 20 minutes by bike or by bus. And I realized I was actually getting to see my patients more on time using public transport or my bike compared to my little car. So that kind of struck me then, that I realized, well, I'm always telling my patients it's really important that you move, go out for a walk, get some exercise. It's good for your mental health, it's good for your physical health. And I thought, but we're doing that anyway when we're moving around, going out to the local shop by walking or taking a train or taking a bus and not using the car. That is healthy, that is active travel. So that's kind of where I kind of got on the bandwagon for this side of my life, let's call it. So just to be clear, because I think active travel is a buzzword at the moment, and I don't think people necessarily fully understand what it is defined as. But basically, active travel is active commuting. So it's how you get from A to B, the movement of your own body from one to get you from one destination to the other. So that could be walking, cycling, wheeling, using public transport. It's basically not using your car, because we don't get any steps. We don't get really much movement when we're sitting in a car because it's sedentary. I'm going to just start off by telling you about a few fun facts, but also a few sad facts. At the moment, we know that transport as a subset is the second largest source of greenhouse gas pollution. So basically, cars produce a huge amount of fossil fuels, which is really bad for air quality, which is really bad for our health. And unfortunately, Ireland has the second highest car dependency in Europe. And what I think is quite poignant is that Ireland was not always like this. And people's memories are short, but there might be lots of people on this webinar today that distinctly remember this. Dublin had an amazing tram system. It was one of the most extensive and impressive in the world. They even had engineers that would come from mainland Europe to Ireland to look at our amazing tram network. And it wasn't just in Dublin. Nationally, we had over 5,600 kilometres of railways. So for a very remote island behind an island country, we were really, really well connected for a small space. And in addition to this, and I'm going to bring this up because when I talk about active travel, and for someone like myself who grew up in the countryside and now lives in the urban setting, and I think the urban rural discussion inevitably comes up, and I do get that, because there's parts of Ireland that are incredibly rural, but the numbers don't lie. And if you look at the statistics, 3 out of 4 people live within a 15-minute walk of a shop. And 2/3 of the population in Ireland live within a 15-minute walk from a pub, a restaurant, or a bus stop. Now, I know the argument is that a safe, accessible 15-minute walk? And that's another discussion. But the other thing I also like to remind people is the high cost of actually owning a car. And it is a luxury item. Not everyone can afford a car. And it's over €10,500 a year. And then I promise this is going to be my last Debbie Downer slide before I get on to some more positives about active travel. But I thought this was really important to bring up because I came across this article in the Irish Times a couple of weeks ago. And there's a lot of discussion, and I'm sure people have heard about it in the news, about the severity of traffic congestion in Ireland. And it is really, really important that we understand how damaging this is to our physical health because of the high amounts of air pollution associated with traffic congestion. And we know that there is clear evidence now that air pollution results in cardiovascular diseases like stroke, high blood pressure, as well as respiratory illnesses. And I found this article in the Irish Times a few weeks ago, and I specifically pulled this one out, aside from the big headings, that is, Dublin is the 11th most severely traffic congested city in the world, and it's the 3rd most severely traffic congested city in Europe. But the reason I'm focusing on this article is I pulled out a line from it, which states that Ireland's transport crisis isn't confined to Dublin, but Dublin is its most extreme expression. And I think that's really, really important, because we hear about Dublin, we hear about how awful the traffic is, the M50 car park, but it's not just Dublin's problem. You hear about it in Galway, you hear about it in Cork. I was at home in my own hometown, and getting through the street was just, it's kind of nightmarish. And everyone wants a ring road or a bypass because that's seen as a way to fix the traffic congestion, which it really isn't going to. But I suppose it's important to note that this is a national problem. It's just we hear about it from our capital city more so. And I suppose something that jumped out to me more, aside from the worrying amount of air pollution that's being created from car congestion, which damages all of our health, is actually people stuck in traffic commuting. A driver loses 95 hours of, do you want to call it quality of life? Do you want to call it life? A year sitting sedentary behind their wheel in traffic. And firstly, that's extremely unhealthy for your physical health and your mental health. You're not moving, you're increasing your risk of chronic illness. And also it's very stressful a lot of the time if you're commuting in peak traffic. But I was talking to a friend, and this really, really struck me. They turned around and said, well, if I'm stuck in my car for a round trip of 3 hours, potentially as a commuter trip, compared to a train where maybe I can sit and read a book, look out the window, but if I'm stuck concentrating behind a wheel, I may not get home on time to help make the dinner or even put my kids to bed. And I think, that really struck me, that, people forget the significant negative impact on a person's quality of life being stuck in traffic has. And I think that's actually really, really striking. Now, I suppose to get on to about the challenges we face in Ireland, and I think we need to really be careful here and be clear that this isn't about individual blame. Because when it comes to individual and societal health, you can't blame the person, because if a person is inactive because their environment is not conducive to allowing them to be active, then how is it their fault? We do have an issue with delayed public transport projects in Ireland, and that's been in the news as well a lot recently. We also have an issue with high car dependency, as we know, and it just becomes a vicious cycle, because if you delay public transport projects, people don't have an alternative to convenient, accessible transport, then therefore people have no other choice but to use their car, and then you just get this vicious circle of a strained, frustrated system. And I suppose as a doctor, I always want to be clear about that. The poor health associated with people being physically inactive is not necessarily blaming that individual, because as we're talking about here, you need to create the environment and system around that person to facilitate that they can be healthy by giving them the option of safe, convenient, accessible walkways, cycle paths, and green spaces. So we're talking about a modal shift and how we can get around for our health and the health of our society and for the climate. If we look at a kind of more global perspective, this slide looks at the global health statistics of physical inactivity. And unfortunately, the Irish statistics are actually worse than both the European and the global averages. And I've say gently highlighted them in red just on this slide. We know that physical inactivity is responsible for 6% of the burden of disease of coronary heart disease, 7% of type 2 diabetes, and 10% of both breast cancer and colon cancer. And as you can see, Ireland is trending in the wrong direction, globally and from a European perspective. So if we bring it back to where we are now, focusing on the Irish population, unfortunately, it isn't great. Physical inactivity, we know, costs Ireland 1.13 billion per year in health costs, which are related to preventable chronic diseases like heart disease, diabetes, high blood pressure, just to name a few. We know that 1 in 4 of children in Ireland live with overweight or obesity, and 6 in 10 adults are insufficiently inactive. We also know that nationally there's over 8,500 premature deaths due to cardiovascular disease, and there are 1,600 premature deaths due to air pollution yearly. And I suppose when we're talking about the air pollution, again, it comes down to fossil fuels, it comes down to our dependency on cars. So if we look then at older people and health, in older adults, we know that 65% of people will live with 2 or more chronic conditions, such as diabetes, high blood pressure, and dementia. So those illnesses are common. And we also know that we're living longer, which is great. Our life expectancy is higher, but that does mean that you're going to end up with an older population who will have multiple chronic illnesses. But I suppose what I want people to think about is it's really important about adding healthy years to life. And this is doable if you remain physically active. We're talking about managing chronic illness as well. We're hopefully trying to get in earlier and talk about avoiding getting a chronic illness. But as we get older, that risk factor is there. So we need to be really thinking about how we can add health to those years. So the magic pill really is about how we promote active travel and using public transport for the health of our population. And I want to bring us back then to the idea of the magic pill, which basically means that you don't need a prescription from a doctor. It's free medicine. It's when you're moving actively in your environment instead of sitting in your car. We need to promote the use of the natural and built environments around us that will help promote active travel, which means then active travel is practical, it's sustainable, it's accessible, and it becomes part of a person's everyday routine as how they get from A to B. And I wanted to briefly discuss 2 anonymous case studies. So these are patients that I have worked with. The first gentleman, we'll call him Joe. He's an 82-year-old and he has a known diagnosis of early dementia, which means he's actually functionally well at home day to day, and he's quite physically well. He doesn't have too many chronic illnesses, high blood pressure and high cholesterol. But he told me on a home visit once that he was told he was medically unfit to drive. And we talked about, I suppose, his loss of independence. That was really important to him because he'd been driving for over 60 years. And we talked about alternatives. And it turns out that Joe usually drives 5 minutes to get to his local village, where he'd stop for a coffee and then he'd go for a walk along the pier. But then we figured out that actually there was a bus stop about 400 meters down the road from Joe's house that he had taken before, kind of knows the bus driver because it's a kind of a regular route, and quite enjoyed that. And he kind of said, well, actually that would be an alternative instead of not being able to use the car. And then we kind of had a chat about the health benefits. And then we realized, well, if you factored in that Joe's going to get his extra steps walking to the bus stop, he was going to be cognitively stimulated because he'd probably have a chat with the bus driver or some social interaction. He was still going to get to his coffee shop. He could still go get to for his walk and then home again. So he just factored in a whole load of extra physical activity in a journey that he was already doing with an alternative to using his car. And then there was another lady that I worked with, and Mary, 69, but she had a diagnosis of Parkinson's for over 10 years. And she was always quite active, enjoyed cycling, enjoyed walking, and was very social. But because of her Parkinson's disease and how it was progressing, she was becoming more physically, let's say, frail or challenged. So she decided to buy an e-bike, a pedal assist bike. And then she basically told me that she now uses this to get to her local shops, to meet with her friends, and that she's kind of adapted life around her chronic illness and kept her independence and also kept herself physically and healthy from a mental health perspective. So that kind of leads me on to when I talk about the health benefits of active travel, that any level of activity is better than none. Literally every step counts. And there's a huge range of benefits that when we move and avoid a sedentary lifestyle, that we can access. And the health benefits positively impact literally every system in the body. And the medical evidence is out there to support it. There's lots of it out there. We know that even low intensity physical exercise like walking has anti-aging effects. And that could just be walking to the local bus, walking to the local shop, walking to the train station. It's a really powerful tool for promoting healthy aging. And active travel also involves moving. So that improves your cardiorespiratory fitness. So that's basically for healthy lungs and a healthy heart. And it improves muscle strength and balance. And that's particularly important for older people. Walking in particular is really important because every time you're walking, there's a pounding movement you're making with your feet. And we know that improves balance and it protects your bones. Thus that reduces falls risk and also your fracture risk. And being a psychiatrist, I really stress the importance of activity for our mental health. It reduces depression, it reduces anxiety, it improves our sleep. And also it's really important for cognitive function. And what I mean by that is how we think, how we concentrate, how our memory works. So keeping our brain healthy, and our brain is a muscle. So and that's really important for helping to offset dementia. The HSE have very clear recommendations about the amount of physical activity people over the age of 65 should get, and it's effectively 30 minutes of physical activity 5 days per week. But it doesn't say what that is. So that 30 minutes in one day could be the 10 minutes to walk to the local shop, the 10 minutes back from the local shop. And suddenly if you're doing that 3 or 4 days a week, you've already accumulated a lot of your steps and your physical movement. Those steps you are going to miss out on if you're leaving your house and getting into your car. The other piece I think is really interesting, and I'm particularly curious about, is the positive social impact active travel has. So again, using public transport, walking, cycling. Irish people, I think we see ourselves as, and I think we're seen as very sociable, but this research may surprise you. And this was a report that was published last year by the European Commission. And Ireland is actually one of the loneliest nations in Europe. 20% of Irish people reported that they felt lonely most or all of the time, compared to 13% of all Europeans. And we now know that loneliness or social isolation is directly linked with dementia, cardiovascular disease, and mental illness. And that absence of social connection is hugely detrimental to our brain health. And this report identified areas to target to improve social connection. And one of these is improving transport. So people have active travel links to get to places and opportunities for social connection, which they will achieve if they're on public transport as opposed to being isolated in their car. And that boosts a sense of emotional well-being. And you just don't get that opportunity unless you are interacting with your environment and other humans. And you just don't get that if you're in a car. So we know that if an older person uses public transport, they will get 400 extra steps per day compared to traveling by car. And to put that in context, and we talked about it already, Ireland being very car dependent, 69% of all our trips in Ireland are by car, even though nearly 30% of those trips are less than 2 kilometres. The other piece, I was talking about it on the previous slide in relation to loneliness, is the importance of social connection. And I like to refer to active travel and how you create social connections as social collisions. If you think about it, and some of you might remember some nice random conversations you've had with strangers when you've been on public transport or walking down the street. You know, so if you're on a train, if you're on a bus, you are more likely to interact with someone else. It could be a driver, it could be the passenger, or even making eye contact. And that's really, really important for our mental health. It's cognitively stimulating, and it really helps create a sense of belonging and a sense of safety, which is also really important. So again, we're coming back to that. If we could just embed active travel into our daily life, it would really, really improve all of these, or I suppose unlock all of these health benefits, both physical and both mental health benefits. And that's, you just don't get that same impact from recreational or fitness focused physical activity. I mean, you can take yourself off to the gym, and that's great, and I'm promoting that. But even just thinking about the basics of getting around from day to day, you're already getting the positive effects on your health and your mental health just through active travel. And when it comes to the financial savings, because, you know, when you work at the health service, they want to talk about money a lot. It's really significant. And this big number of 64.5 million that the HSE saved in 2023 was actually only in Dublin. That's not even a national statistic. And also, we know that if people use public transport or active travel in Ireland every day in the 5 major cities, that takes 680,000 cars off the road. And the way we would see that is that 680,000 people who are out there getting to work, just getting to the local shop, moving. So improving their health and also the climate. And that famous old saying is age is but a number. When I was doing a little bit of research into this, and I was talking to my parents about this as well, and thinking about it, that I work with people over the age of 65, and one of my oldest patients lives at home independently at the age of 97. I kind of feel I've seen a spectrum of demographics and age groups. But in Ireland, we're very lucky. The free travel pass, if you're lucky enough to get hold of one, but I think it's something that is available to many over the age of 66. 1.1 million people in Ireland have a free travel pass. I was actually really surprised by that number. And I think that's brilliant. I think that's 1.1 million people who have the choice to use an alternative to their car. And I suppose the other piece is that it's getting better. If you look at the Transport for Ireland local link services, the options there are becoming available. And the local link service in particular, since they rolled that out in 2023, that has been hugely successful and there has been great uptake. So it kind of shows that, if people are given the alternative, they will avail of that option. I'll go quickly around some of the pictures on this screen, and this is just to put it in context. So the top picture there with the bus and the nice view, that was the picture that I took when I was on the Rural Link bus from Galway train station out to Lettermullen, next stop America. Very, very remote. Myself and my husband had taken the train from Dublin to Galway, literally exited Galway train station, hopped on the local link. Now we competed with some of the Gaeltacht students who are all heading out to the west during the summer, and literally the local link drove us to our door of our accommodation that we rented. We were staying there for a few days, and there's my husband's aunt waving the tea towel to flag down the bus, who dropped, the lovely bus driver literally dropped us at our door, and these amazing views. It was really, really, really lovely. And I suppose the other piece is that this is cycling without age. There's a lovely picture of older people all supporting each other getting around by bike. And one other thing I wanted to think about when I was, this idea of age is but a number, is the idea of time. And I think we live in a very busy, stressful, fast moving world. And I think active travel, whether it's you're sitting on a bus, sitting on a train, looking out the window, walking or cycling, it does give you a chance to slow down and hopefully enjoy your space and hopefully reduce stress. And I think that's also really important. And I'm kind of hoping if you're an older person, maybe retired, you've got that precious gift of more time, and you want to use it when hopefully you're healthy and able to move around safely. And then just to finish off here, just some takeaway messages. Basically, there are huge health and climate benefits to be gained from active travel as we all age. And the Magic Pill report and some of what I was talking about here today is a very important public health intervention. And any physical movement is essentially free medicine. And in particular, I like to refer to it as therapy on the move. And that's really important for both our mental and our physical health. And lastly, I suppose I'd argue that we need to lead by example as healthcare professionals, but just any of us who believe the cause for active travel. You know, we need people to understand the benefits of physical movement engineered into our daily routine through active travel. Active travel needs to be convenient, it needs to be safe, it needs to be accessible, and it needs to be compatible with daily life for how we get around. And the Irish Doctors for the Environment and Climate and Health Alliance, I think at this point, you know, we believe it is a political issue. We need our government, we need our leaders to understand that transport policy is a health policy. And I'm going to end on this last slide where I found this quote, and some people may have heard of this before, but I think it's quite and the quote is, "A developed country is not a place where the poor have cars, it's where the rich use public transport." And that's the end of my presentation. So thank you all so much for your attention and time.
So thank you. That really was a fascinating session. And I want to thank Caoimhe and Orlagh for giving us of their time and knowledge in such an inspiring, generous way. I learnt a lot, and I suppose when you talk about things that were surprising, that Ireland had such a fantastic public transport system over 100 years ago, and also that people in Ireland are so lonely. This goes against what I think people would believe about Ireland, so fascinating in that. And also really the facts showing the health benefits of getting up and off your bahookie are so clear. So some contact details will appear. In fact, by magic, there you go. If you want to get in touch regarding this webinar, and I'll draw your attention to the excellent Climate Health Alliance position paper, which Caoimhe was talking about. We've recorded this webinar, and we'll contact everyone who registered to give them a link to be able to watch the recording later, or indeed people who didn't see it now will be able to catch up later. We'll also be sending an evaluation form to fill in, and we would greatly appreciate it if you could share your reflections with us as part of our learning to help us improve our work going forward. And thank you to everyone who joined the webinar. As I said earlier, this is the first in a series of webinars under the umbrella of Healthy Aging, Healthy Planet. We'll have another in the first week in March on sustainable diets for you, for the planet, and there will be more to follow. Thank you to Irish Doctors for the Environment for being so open and supportive of these webinars. Just a brief word before we go. In practical terms, what BOLD does, well, obviously we hold these webinars. We do in-person education and action-orientated workshops also. We partner with other age and climate organisations to campaign and educate at local and national levels. And really, our core belief is we want older people to be seen and heard on the climate crisis in the public arena. And new members are always welcome. So please do get in touch if this is tickling your fancy. We are supported by Friends of the Earth in the work we do. The solidarity of their ongoing support is valued greatly by us, and we want to say a big thank you to them, but especially to Emma Jane in particular, who's had our backs on every step of BOLD's journey. And in relation to this webinar, I know she has done some seriously Trojan work. So I think that's about us. I just want to say briefly something that active travel on a personal level, yesterday was a terrible day. Horrible rain, and I was sitting indoors until it was about to get dark. I thought I better get out and get my steps in. So waterproofed up, got out there. Lo and behold, the rain stops in 10 minutes and a fabulous sunset was able to be viewed. It was almost like a present. So I think, if you can break out, even if the weather's not great, take the walk, you'll feel the better for it. And I would say that was the living proof. So thank you so much, everyone.
Thank you.
I'd just like to thank everybody so much for coming along and for all the support from Friends of the Earth, from Emma Jane, from Rod, from Christine, from everybody involved, and a special thanks to Kiva, who's just blown us all out of the water. She is our active travel champion. So we are really looking forward to delivering more informative webinars. Our next one will be on Thursday, the 5th of March, on sustainable diets and its positive impact on health. So we're really looking forward to our session on that. And do send us any questions. We would absolutely love your questions. We just love to. This is what we do in our free time. We're very happy to talk about talk to the cows come home on active travel, on anything climate related. Please do send us any questions that you have via our email. I've left it in the chat and it was on the slide there.
Thank you.
Thank you, Orlagh. Thanks, Rod. Thanks, Christine. Thanks, everybody. And massive thanks to our funders as well, Irish Aid. This work with Bold and the collaboration that we do is only supported and made possible through the incredible Global Citizenship Education project we have with them. So thank you so much for their ongoing support. Thanks, everybody. We'll let you all go. We'll be following up with you very soon. Expect an email with a lovely evaluation form and loads of resources that were spoken about and shared here. And we'll follow up with you and look forward to seeing you at the next one. Bye.